Hello and welcome to another episode of Old Channel Old Health. I'm your dietitian Jeremy.
I'm your nutritionist Wenxin.
Hey, hi Wenxin. So today we're going to talk about something that would probably take our breath away.
Yes, but before this, Jeremy, let me ask you a question.
Yes.
Guess what am I doing now?
Talking?
No, I'm breathing.
Yes.
Actually breathing is some body function that many of us ignore and unaware of because
correct.
it's an involuntary process.
Correct. So we like it or not, we have to breathe. Okay, whether you are having shallow breathing, you're having deep breathing, right? All this comes voluntary. You cannot say, I don't want to stop. I want to stop breathing. Right? I cannot have without air. Okay, we cannot live without breathing or without oxygen for even 5 to 10 minutes.
Yes, but many of us still unaware of this. Maybe they just know how important is breathing when they are at their last breath, or when we are swimming, we want to exchange for the air, or when we are doing some vigorous exercise, we feel out of breath. Only now we know how to appreciate how important breathing is.
Yes, correct. Especially when our age is catching up. Okay, you could notice that last time when you were in a teenager, you can actually run up to 10 flights of stairs without gasping for air, but without puffing, But for now, as you reach 30 or even 40 or even some elderly, uncle, auntie at home, sometimes you just wanted to climb a flight of stairs. It will actually take them quite a bit of effort, and they will actually take a bit of time to recover from the shortness of breath.
Yeah, so the topic we're going to discuss today is named as Chronic Obstructive Pulmonary Disease, COPD. Actually, it's a kind of progressive disease that makes you have some obstructive or difficulties in breathing.
Yes, correct. So similar to what we have shared before, for example, fatty liver, liver cirrhosis, which is a long, chronic, progressive disorder that happens over time. So similarly, like our lungs are also like our engine. It will actually slow down, it will actually decline over time. But there are many factors, external and internal factors, that could actually affect how well our lungs work. Alright, so stay tuned and remember to like and comment and also share this video to all your friends, relatives, or even some elderly at home, or they are already having some signs and symptoms of shortness of breath or COPD, then you should stay tuned to our sharing today.
Yes, so let's look at our news today. We have articles from the Harvard Health Publishing, Harvard Medical School, saying that chronic obstructive pulmonary disease, it takes your breath away, and this COPD is the fourth leading cause of death in the US and expected to take about 126,000 lives this year.
Yes, correct. And why do we say it is one of the silent diseases? Because many people, when it comes to when we talk about diseases that kill, probably we would be very aware of cancer.
Yes.
All right. And cancer takes a lot of this attention from us. Okay, but without knowing the statistics, we actually find that COPD is one of the main killer for Malaysians as well. All right, there's a projected case prevalence of about 5% of Malaysians that actually experience moderate to severe COPD, and many clinicians have actually indicated that COPD have been very much neglected, by our public.
Yes, because the symptoms at the early stages, they are very mild. You won't even notice that it is a manifestation of the COPD.
Correct.
You're just thinking that maybe you're getting older, maybe you don't get enough exercise, maybe you don't eat well. But before we proceed into telling you more detail is on what COPD are and what are their risks and symptoms, let us have a little understanding on our anatomy of our lungs.
Yes, we should know how our lungs look like. Okay, so now as you can see from the diagram, our lungs actually come with of course, our nasal passage, the nose, where the air enters, and subsequently it goes into the trachea. Now, trachea is where the main hose, the air hose, and subsequently the air will travel through the trachea into the bronchus, or bronchi. It branches into a pair of lungs, and that's where within the lungs, we have the little tiny air sacs called the alveoli. So alveoli is where the exchange of air happens, between our body cells, our blood, the exchange of oxygen and also the carbon dioxide.
So when we breathe in and breathe out, our chest will expand, isn't it? So
Correct.
it's because our lung expand. And when you breathe in, the oxygen go into your lungs, into those little
Tiny air sacs. Yep.
These air sacs can be described as a balloon. It will expand as well. When you
Correct.
breathe out, this balloon will contract and then it expels out the carbon dioxide out of your lungs.
Correct. So why do we encourage people to do deep breathing? Is because you want to inhale as much as possible. You want to expand your alveoli as much as possible so that you fully utilize them. Because otherwise, over time, okay, these tiny little air sacs are like those rubber band, you know. Okay, if you don't use it for very long, if you leave it under the sun, if you leave it under some damages, it can actually become very brittle and then it will actually break. So your alveoli, once it breaks, it's irreversible. Okay, the lung cells don't grow again. Okay, so what you're gonna get is your lung function will decline, okay, and deteriorate over time.
Yes. So now we're going to introduce these two types of symptoms of this COPD.
Yes, actually there are two types of COPD. One is known as the chronic bronchitis, okay, and the other one is the emphysema. Now, chronic bronchitis, as the name sounds, okay, it means that there is some degree of inflammation in the bronchi. Okay, so within the bronchi, where the air travels through the lungs, it actually causes a lot of this inflammation. Okay, and over time, inflammation, what happens is it will produce a lot of this thick, very viscous kind of mucus.
Yes, when there's a lot of mucus in the lining of this bronchi, then it will obstruct the flow of air.
Yes, correct. Imagine, like, let's say you have a water hose, okay, and somehow there is some glue, okay, or gum in the water hose, and you try to turn on the water tap, the water will not be able to pass through easily, and it causes a lot of this obstruction and pressure within it. So over time, what people will get is coughing. Okay, this is the most common signs and symptoms when you have a chronic bronchitis, from low, mild cough to very severe cough type. And another type is?
Another type is emphysema. This is, you can see this visual is our alveolus, the alveoli, which is a tiny little air sacs. So the healthy one should look like this. And another one, when you have emphysema, your alveolar, those structure, those tiny walls will break down, maybe become thicker, and they don't have a really distinct air sacs already. Maybe they will fuse together. And when you have fewer air sacs, it means that you have an insufficient exchange of air as well.
Yes, imagine once you actually have 100,000 balloons, okay, in your lungs. Okay, but over time, maybe it reduces to only 50%, only 50,000 balloons left. So the amount of oxygen that goes into your body, goes into the blood, it will also decrease. Okay, and when you lack of oxygen, what you're gonna get? Lethargic, tired, headache, you know, you just feel so tired, no energy. So these are the signs and symptoms that people always think is due to aging. Okay, normal aging, but it is not a part of normal healthy aging.
Yes, let us have a more detailed look on what are the common symptoms of this COPD. So actually COPD can be, because it's a progressive disease, it will start from a mild symptoms to and then worsen, become a severe one. So for those mild symptoms, you can get maybe a coughing, chronic coughing, maybe you keep coughing for 3 months and then you still can't recover from it. And then you have this wheezing. Wheezing is the kind of whistling sound when you breathe in and breathe out, isn't it?
Yes, the kind of, when people sometimes they relate it to asthma, because asthma is the same thing, because the bronchus, they get constricted, okay, the narrowing of the bronchi, so that's where the air passages is not smooth enough, and that's where it creates the sound, the wheezing sound. Alright?
Yeah, so when your trachea, your bronchi have been contracted, then the body, this mechanism will force it to expand through coughing.
So that's where another thing that we also observe is the excess phlegm or sputum, okay, which is commonly seen in chronic bronchitis. Alright, so why do they actually have this chronic bronchitis? Because it is a normal mechanism. When your cells or your tissues are inflamed, our body will secrete this mucus to enhance the healing processes, alright, and to also protect the inflamed areas or inflamed cells. So when this mucus become very thick, or very chronic. It's like gum, you know. So when the gum stays there, of course, you will not be able to breathe properly, and even it will affect your normal daily living. For example, when you sleep, you're gonna get coughing because of phlegm, or even when eating, occasionally you will get choked because of the phlegm or the sputum, or even when you try to, you know, take up some flight of stairs, and then you will also feel there's something that clogged in your airway, and you don't feel very comfortable.
Yes, you can observe actually many elderly, especially those over 40 or 60, 50, that early in the morning they will have this cough with the mucus.
Yes.
Yeah.
It could be those inflamed one, like yellowish kind of sputum. So this is actually the sign of inflammation going on, or even infections in very severe cases.
So yeah, next we have shortness of breath. If it's a difficulty in breathing, maybe you find out that when you're climbing maybe just some stairs, you feel very hard to breathe, and when COPD become worsens, then maybe even we are doing some easy daily tasks, maybe changing your clothes or even talking, you feel that you are out of breath.
Yes, correct. Sometimes when you see those elderly, you know, they having shortness of breath, you actually think that it's a normal part of aging, but you may not actually realize that even when you are at the age of 30 or even 40s, sometimes we also will feel the difficulty when we climb just two floors of staircase. You actually feel like you take longer time to recover, okay, and to return to your normal breathing rate. So this is actually the signs, and why we are saying it's progressive, because it doesn't just happen at the age of 60 or even 70. It happens way before that. And if you have some symptoms or risk factors that you don't control well, it will actually progress even faster.
Yes, so normally those with COPD, they have a lower body immune system, and they will easily get infected in their respiratory system. So they will easily get catching a cold, having a flu, or being infected by influenza.
Yes, correct. Or even in severe cases, they may get pneumonia, and then you have to be warded, to hospitalize, and then to receive a lot of these antibiotics treatments. And when your lungs are weak, okay, that's where the air that goes into your body may not be sufficient enough. So it actually affects all your entire system, your brain, your heart, your digestive system, your liver, all of them will be affected, because all our living tissues, they need oxygen, okay, for proper functioning and of course operationing.
Yes, and next we have lack of energy, feeling very tired all the time, and have unintended weight loss in later stages. Why people with COPD will have weight loss?
Okay, because normally for COPD, okay, as they go into moderate to severe cases, okay, or stages, that's where they take more effort to breathe. Okay, normally when we breathe, probably we just need to breathe like normal, but for some of them, when they have COPD, because of the constricted airway or the inflamed airway or even the mucus, they need to breathe harder, okay, in order for them to get the oxygen they need. So when you spend more energy in breathing, of course, when you are eating lesser, because normally for COPD patients, they tend to have lower appetite. Okay, they tend to have this smaller appetite or bloating, and of course the diaphragm itself will be affected also. So that's where when you eat less, but you actually spend more energy in breathing, so over time you are gonna have unintended weight loss. So when you see people with COPD, you tend to get very thin, okay, at the very severe stage of COPD.
Yeah, some other symptoms of COPD also include swelling in the ankles, the legs, and also some people in those very emergency cases, when they are out of breath, they are lack of oxygen, their lips or nails started to turn grey or blue.
Yes, or even purple, because it doesn't have enough oxygen. So that's where they become very pale, and that's where you also see they become very slow, very lethargic. Even the way they talk becomes very slow.
Maybe they can't even focus already because their brain is out of oxygen as well.
Correct. Okay, so now that we have learned about the signs and symptoms of COPD, now you may actually think, recall some of some of your relatives or your elderly or grandparents that have these signs and symptoms. But remember, if you want to prevent COPD from happening right from the beginning, you have to first know who are at risk of this COPD.
Yeah, so we classify the risk factors of COPD into one, internal and external, but let me put this word first. Actually, most of the cases of COPD are caused by tobacco smoking.
Yes, tobacco smoking.
Almost 75% of COPD is led by smoking.
And COPD, due to smoking, and it's mostly happens in the alveoli, okay, the smallest part of our lungs and the most critical part of our lungs, that is the alveoli, and that's why we call it as the emphysema. So most smokers, when they are diagnosed with COPD, they often have this diagnosis called as the emphysema.
Yeah, so let's look into these internal factors. First, we have these genetic factors caused by the deficiency of alpha-1 antitrypsin. This alpha-1 antitrypsin is actually a protein that made in the liver to protect our lungs. So when your body have these genetic problems, cause you to produce less this protein, and then that's why your lung will be more susceptible to a lot of diseases.
Alright, so it means that your lungs, when you are born, okay, genetically, you are already at what we say susceptible or prone to these lung diseases or even poor lung functions.
Yes. And the next is people with chronic inflammatory airways disease such as asthma. So actually there's a lot of studies research on asthma, the relationship between asthma and this COPD, and they are actually interrelated. Those with asthma, actually they have COPD in their early stages and they do not know about this.
So that's why if they already have this inflammation already happening, so of course over time it may or may not progress to what we say as the chronic bronchitis or emphysema if they manage their asthma well. Alright, so it doesn't what we say we actually can delay or to relieve the inflammation that happens in the lung airways.
So but some people may have this question, what is the difference between asthma and COPD? Because both they are manifested as a shortness of breath.
Correct.
But actually they are different. For example, like COPD, it is progressive disease, so it will worsen over time.
Over time, a long period of time.
Yes, but asthma is not. Maybe normally asthma will onset in early stage, for example, kids. But for COPD, maybe they will happen maybe after 40 or 50. But it did not means that those younger people won't have COPD, just that normally it happens in elderly people.
Yes, what we say is asthma is more of the acute onset type, okay, because once it happens, it really has the constricted airway and you really have a very severe shortness of breath. But COPD is a very chronic, long process that takes over quite some, 10 to 20 years of time for you to develop the lung function deterioration.
Yeah, and another distinct difference is that people with asthma, they will rarely have this mucus, but COPD is coughing with mucus.
Yes, correct. And another factor would be, of course, aging. Okay, as we know, as we age, natural aging takes place. So do our lungs. So if you are already at the age of 60 and 70, of course, the risk of getting this COPD is even higher.
Yeah, and then last one is gender. So mostly smokers, they are males, but
yes,
there are studies found out that actually if women, they are being diagnosed with COPD, their risk of death is even higher.
Yes, correct. And we see that for men, it would be 1 out of 10 men would be already having this COPD. Okay, and as we say, smoking nowadays, although we say men is more prevalent, but we also see rising prevalence of smokers among women. So it is something worth mentioning and of course to take note of about.
Yes, and another reason is, let's look on these external factors. So chronic smoking, including second-hand smokers, also will cause COPD. So actually, many of the women, even though maybe they are not smoking themselves, but they are second-hand smokers because their husbands, their boyfriends, their brothers, maybe they are smokers.
Yes, correct. And not forgetting even aside from second-hand smokers, even third-hand smokers. Okay, why when we say you go into a car, okay, you can actually smell the tobacco smoking, the scent, the aroma. Why? Because this tobacco oil, they actually attach, okay, or leach into the cushion, the sofa, the floor, the walls. And imagine over time when you're living in this environment, whether in a house or in a car, you're actually exposing yourself to something called third-hand smoke. And third-hand smoke is way worse than direct smoking and of course the second-hand smoking.
Yes, and also we have here the exposure to work-related dust and chemicals. Some people maybe they are working in factories, in chemical industry. They will occasionally and always exposed to those chemicals,
Yes.
dust, because you know the factory, the condition sometimes.
When the ventilation is not good enough, so that's why they will have a lot of these chemical residues. So we know that a lot of these acids, alkalis, okay, under some certain heat and pressure, they vaporize and then they cause a lot of these irritants. Okay, they have all these irritants that can irritate our respiratory system, okay, our airways, and if they are not doing protective, okay, they are not wearing this protective gear, then over time it can actually lead to chronic inflammation of our lung airways.
Yes, and lastly, we have long-term exposure to fumes from burning fuel or other air pollution. So aside from air pollution, actually they found out that those housewives in developing countries, especially when they are using coals, charcoals to cook indoor, that means that they have poor ventilation. The risk of these housewives of getting COPD is very, very high.
Yes, another factor to also note that we know that sometimes when we cook at home, okay, we like to do pan frying, we do deep frying. So most of the time will be the housewife, our mothers, okay, so that's where when the food is cooking, when the oil is cooking, during all the emission, so we tend to get very close contact, okay, to all the fumes and oil. So if the mothers or the housewife keep inhaling all these fumes, so these are also what we call as irritants, and it can also make our airways inflame. Okay, so mothers at home, do take note. Make sure when you are cooking, okay, you have proper ventilation and stay away, okay, not too near, okay, to your pots or your woks. All right, so this can actually help to prevent you from inhaling too much of the oil from the cooking.
Yeah, and another point is if you can eat less of deep fried or pan fried food to make you healthier.
Yes, correct. So that's why people are now using air fryer. They try to reduce the usage of oil, and it also saves money because it doesn't burn too much oil in all this deep frying.
Yes. So we know actually COPD, there's internal and external risk factors, but mostly it's related to external one, smoking. So if you have family or friends are smoking, you may ask them to reduce slowly their smoking frequency and try to omit this bad habit.
Yes, because I know it's hard, but to be frank, it affects not just the smoker themselves, they are affecting the entire family as well. So to keep yourself away and to make sure you have proper lungs that work well, okay, you have to do prevention from the beginning. Okay, so now that we have learned the signs and symptoms, we have learned about the what are the risk factors. So of course you may be wondering, okay, let's say if I'm not taking care of my lungs, or I already have emphysema or chronic bronchitis, so what is going to happen? Okay, what are the complications of this COPD?
There's a lot of complications. Let's look at here. The first one is pneumonia.
Okay, pneumonia is actually the lung infection. Okay, the lung infection. So it's actually quite common. Okay, when we go into the medical wards, okay, most of the people who come in will be due to pneumonia, okay, community acquired pneumonia, and they actually studies find that people with COPD, okay, whether you're emphysema or chronic bronchitis, you are 6 times more likely, okay, or at higher risk of getting this pneumonia or lung infection than those who do not have COPD.
Wow, 6 times higher risk.
And imagine, as what we mentioned just now, when you already have COPD, your lungs are at a weaker side. So when it's weak, and of course it will be more susceptible or more prone to lung infections. And now we know that our air, our surrounding is filled with all sorts of unknown viruses, alright? So you have to take care of yourself and also your lungs.
Yes, and next one we have acute respiratory distress syndrome. Actually, this means that your air sacs, your lung is filled with water, the fluid inside your body. Then when your air sac is filled with this fluid, then you have a harder exchange of this air, this oxygen.
Alright, so imagine if you have a balloon, okay? If you fill it with air, of course, the air will be contained properly inside. But once you fill the balloon with 50% water, so of course the air cannot go in properly, and that's where the exchange becomes very difficult, and people often have shortness of breath. And this is actually quite common in COPD, or even in people with what we say this chronic kidney failure, because their body stores too much water and unable to excrete it. It may also lead to this ARDS, or acute respiratory distress syndrome.
Yes, aside from this, those with COPD may have a 20 to 70% higher risk of getting heart failure.
Okay, why is it heart failure? Okay, so remember what I said just now, when your body is lacking in oxygen, okay, it's a normal reflex for your body and your brain to trigger your heart and to pump faster to get all the oxygen and all the air to your entire body. So when your heart is pumping faster and it's going to get wear out, okay, tired.
Overworking.
Yeah, overworking, OT all the time, alright? So over time, your heart will actually bengkak, okay, swollen, and it will actually affect the lung, the heart function as well.
Yeah, so wow, not only just the lungs, but it will cause the heart disease, because we know that many people is aware of the importance of heart disease, heart attack, but they do not know that actually when there's something wrong with your lung, there will be something wrong with your heart too.
Yes, correct. And most of the people who are hospitalized of COPD at very severe stage and very last stage of COPD, they mostly succumb not due to COPD but due to heart failure, because eventually the heart just dies off and it doesn't work anymore.
Yes, and next we have frailty, which is feeling weak, feeling tired. We have the 55 to 60% higher risk. And then lastly, we have depression. Those with COPD, they are likely to get into depression. We have 2 times higher of risk.
Okay, why is it people with COPD tend to get this depression? Because imagine if you used to go out, to do your grocery shopping, you do your exercise, you meet your friends, or last time people go for Tai Chi, you can have all your activities of daily living. But ever since you notice you cannot breathe well, and then you get very constant tiredness, you just want to lay on the bed, rest at home. So there will be some social isolation. Okay, you may not be able to mingle very well with all your social activities. So that's why people find that people with COPD, they actually develop depression more easily than those who do not have COPD.
Yes, and actually depression and COPD, they are interrelated. When you have COPD, you are getting depressed easily, and when you get into depression, it could worsen your symptoms, your COPD complication even more, because when you are feeling out of mood, depressed, you don't likely want to continue your treatment for COPD, changing your lifestyle, which makes your lungs getting even worse,
weaker. So that's why we say, even we notice sometimes when we are very low, when we are very slow, sometimes even our breathing rate, okay, or the breathing pace also becomes very shallow. Alright, so when your breathing becomes very shallow, you are not fully utilizing your alveoli, okay, your air sacs. So your air sacs over time will become hardened, alright, and it doesn't goes very well with the air exchange also.
Yeah, another kind of emotional relation with COPD is that research found out that those with COPD, they also likely to get into Alzheimer. Those are mild cognitive impairment, especially related to thinking skills, cognitive skills.
Yeah, so you can see it's widely related. Okay, it could be due to the emphysema or COPD, or it could be simply due to the social isolation. Okay, you are not able to do or continue your activities of daily living. That's why it leads to a lot of these mental health issues as well. So COPD is not something to be neglected. Alright?
Yes, so we know that COPD can't really be cured or treated, because
it's irreversible.
Yeah, doctors can just help you to manage your symptoms. So we know that when you're still healthy now, it's very important to take care of your lungs. And if you have COPD already, it's still important to maintain your lungs health, to make it worsen less.
Correct. So now that you are in old health, of course, when I tell you how to do some prevention, all right? So aside from looking into the risk factors itself, if you already have these risk factors, of course, you have to try and manage it, all right? And the other thing is, of course, you can actually work by improving your food consumption, your food intake. So of course, there are some foods that your lungs would really love them.
Yeah, actually there's a lot of nutrients and food groups here, and actually we can find out that many of them are antioxidants. Why? Like anthocyanin, lycopene,
omega-3,
vitamin
quercetin.
E, vitamin C, which is not listed here. They're all antioxidants, but why antioxidants they are so important to lung as well?
Okay, because when we breathe in air, okay, we do not know what we breathe in, all right? So there will be a lot of these harmful particles, the haze particles, the smoke particles. So all these things are what we call as irritants. Okay, so when these irritants go into our lungs, it will trigger a lot of these free radicals. Okay, if you have been following our channel, you will definitely know what is these free radicals. Okay, they are these unstable molecules that goes into your body and make a whole havoc inside your body. All right, but free radicals, remember, they are essential. Okay, they are needed by our body to control some abnormal body cells from happening. But when it becomes excessive, okay, when it becomes really uncontrolled, that's where it causes a lot of these issues. So when they are in the lungs, it will cause a lot of these inflammation, infections, redness, and all these things. So antioxidants, okay, is to suppress the oxidation. So that's why you can see all the what we say natural plant foods, okay, where all the antioxidants are the ones that can actually help to improve the oxidation.
Yeah, and most of the antioxidants they have this anti-inflammation properties. Yeah, so like for example, anthocyanins, which is found in purple or red or blue color foods.
Yes, correct. So we have over here like purple cabbage, purple sweet potatoes. Okay, we have blueberries. Okay, we have purple onion. So all these things that comes in purple, black, blue, okay, they are very good source of anthocyanin. And another thing also we have the omega-3 and vitamin E.
Yeah, with the omega-3 and vitamin is richly found in nuts, seeds, in plant-based food.
And even some cooking oil like natural palm oil or sunflower oil, they do contain natural source of vitamin E. And we know that omega-3 you can actually find in a lot of these flaxseed, chia seed, walnut. So all these are very good sources of omega-3. And also we have something called the quercetin.
Quercetin, this compound actually is found in red onion, apple, even green tea, buckwheat.
Yes, and also like propolis, all right, the green propolis, even they also have this quercetin. So what is this quercetin about is, it is a unique, what we say, a plant phytochemical, okay, or plant antioxidant that works especially well for lungs health, okay, or for our respiratory health.
Yeah, and next we have green leafy vegetables, especially chlorophyll, because we know why the vegetables are green color because of the chlorophyll. Chlorophyll is which good for blood, purify our blood, and promotes a better blood flow to our lungs.
Yes, correct. When your lungs are having this good blood flow, then definitely they're going to have a better air exchange as well. And next we have which is the lycopene.
The red colored fruit, tomatoes, watermelons, and then
grapefruits,
red pepper,
pink guava. All right. So all this that comes in red color, they contains the natural lycopene. But remember always, lycopene must be eaten slightly cooked, okay, or with oil, because it is the oil-bound antioxidant. And when you consume raw tomatoes, the lycopene, they are locked in the cells. Okay, so it is very hard to be absorbed. Well, once you cook it with heat and with some oil, the cells will be broken, and that's where the lycopene will be released. And once it is released, it is easier for absorption and used by our body.
Yes, and it is similar to beta carotene, which is a precursor of the vitamin A. Yeah,
correct.
So it can found in carrots, pumpkin, and other orange color foods.
Yes, anything red sweet potato, yellow sweet potato, anything that you can see in yellow, orange, or yellow capsicum, okay, they are perfect source of beta carotene.
And lastly, we have high fiber foods found in whole grains, and also this mineral, selenium. This selenium is, I think, is a quite unpopular minerals.
Yes, correct. It is actually a trace mineral, but you only need in very small amount. Okay, but selenium is actually a rising mineral of interest, because what we know is the vitamin A, C, E, okay, as the antioxidants, but selenium itself is a very strong antioxidant. And many studies have found that if you consume enough selenium, it can actually help to reduce the risk of getting cancer.
Yeah, and selenium actually is very important in the reproductive system and also in the replication of the cells in the DNA. So we can, selenium maybe in plant-based food, it is richly found in Brazil nuts. Eating 1 or 2 of Brazil nuts per day is enough to meet your demands for selenium per day.
Yes, and of course other nuts and seeds, or even like cereals, sometimes they have all these natural food sources of selenium, because selenium comes from the soil. So if you consume the grains, okay, like for example rice, if you consume what else, wheat or even corn, okay, as long as the soil contains selenium, so that's where even the crops itself will have the natural source of selenium.
Yes, and don't forget the most important one is which is water. To keep your lungs hydrated is very important, because we know that when you have chronic bronchitis, there's mucus in the lining, isn't it? So drinking sufficient water helps to clean out the mucus, helps you breathe better.
Yes, correct, and it actually helps to expectorate. That means it actually helps to clears this mucus from the body as well. And another thing that we'd like to note is for people with COPD, okay, it's very important to observe the amount of carbohydrates that you take, okay, especially refined carbohydrates, because carbohydrates, when they are digested in our body, they will actually release a gas called the carbon dioxide. So we know that people with COPD, they don't really get this air exchange very well. So that means their body tends to retain too much carbon dioxide. So when you have too much carbon dioxide, it will actually force your lungs to work even harder to have the air exchange, okay, to remove the carbon dioxide and to get in more oxygen. So what we can do is you can actually reduce the amount of carbohydrate that you take, but you replace them with something healthier sources like healthy fats, okay, or even healthy protein, and the carbohydrate must be of the whole grain type. Alright, not the unrefined, not the pastries, okay, not the sugars, not the confectionaries, okay, these are the big no-no for people with COPD.
Yes, and also if you're a meat eater, try to reduce the amount of processed meat, because some compounds, maybe nitrites in the processed meat, they are very bad to your lungs and other body parts.
Yes, correct. So of course, we will advocate you to eating more plant-based foods, okay, more plant proteins. Healthy fats could be coming from flaxseed oil, chia seed, or even like avocados, okay, or even nut butters. Okay, these are very good sources of plant-based protein and plant-based fats that could actually help to reduce your carbohydrate intake, but at the same time, you're not compromising on your overall energy intake in a day.
Yeah, and also for those who already have COPD, a friendly reminder here is don't overeat, because when you're eating too full, your stomach may maybe obstruct your lungs expansion. Yeah, then it makes your breathing even more harder. So you can take small meals, maybe increase the frequent small meals.
Correct.
And for those who are still healthy now, you have a healthy pair of lungs, keep on your effort in practicing a healthy diet, your healthy lifestyle, and don't forget to breathe, because many of us are in a shallow breathing nowadays.
Yes, correct. Just do deep breathing. Try your best to deep breathing, because you want to try to expand your alveoli. Okay, you wouldn't want them to keep very small and then very tiny. Eventually they get hardened and then they don't work well anymore. So take care of your lungs, because we want to make sure we can still breathe in, we can still do our daily activities even when we are at the age of 90s or even 80s.
Yeah, so I think that's all from us today. If you have any question on how to take care of the lungs, you can PM us or comment in the section below. We still have our nutritionist team to take note on your question.
Yes, to address all your inquiries. Okay, alright, until then, thank you for watching and hope you like our sharing, and don't forget to like, comment and share to all your friends and family. Okay, until then, see you again on next episode of O Health on O Channel. I'm your dietitian Jeremy.
I'm a nutritionist Worsens.
See you till then. Bye bye.